Our next guest is joining us for the first time. Please welcome to the show, Dr. Pegah Homayoun.
There she is. There she is.
Hi.
My doctor.
Your doctor.
Is here. Yes, this is my doctor. Pegah,
Yes.
welcome to the show.
Thank you so much. It's lovely to be here.
Thank you for being here. You've been sticking needles in me for a while now.
I have.
And I should make it known, by the way, that I'm deathly afraid of needles.
Me too.
So, I mean, deathly afraid of needles. And the first session I did with you was almost like torture for me.
Thank you.
For me.
But it turned out okay.
There was no pain.
Well, that's good to know.
There's no pain. You don't feel it, but it's just like you have this weird feeling. If you're a needle phobic, like I am, then you kind of have this weird feeling like, okay, there's needles in me. But I was convinced I had to come see you. I did. I'm very glad I did. We've become friends. We chat a lot during our sessions.
We chit chat.
And what's really interesting about your story is that you went to medical school. So you kind of went down the Western path of like going to medical school, all that stuff. But then you decided to practice sort of a more holistic Eastern style medicine. So I'm really curious how someone makes a decision like that. I've never asked you this before.
No, you haven't.
Why did you choose to do that?
I think it makes more sense. It resonates more with me. So the way I see health and the way I see taking care of people is more of the Eastern model for me. There's a lot of prevention that I think is important to take place initially. And then, of course, if something does come up, we address it. And oftentimes there are things that come up with patients that no one really knows what it is. They know that luckily there's no red flags in terms of any kind of lab work or anything, but they can't explain why they're having a certain symptom. And I can, which I think that's really cool. And oftentimes they have a name, which I think makes patients even more comfortable because they know that it's not just in my head.
Right, they have a name.
There's a name for that.
I'll give you a couple examples. In one instance, so I have I think we have some arthritis happening right here. There's some degeneration going on and it has to do with the forearm and these tendons and ligaments are all connected and stuff like that. But it was like this for, just spazzing constantly for like 3 straight days. Went to see Pegah, put a needle in there, done. Hasn't happened since. So that's an example of one situation where there was something happening and she was like, okay, this is probably what's going on. Boom, sticks it in there. Also, my right knee was hurting. It felt uncomfortable. It was weird. I was walking, I was like, I have pain in my knee. And knee pain is not something to mess with. Like, you need to go see a doctor pretty quickly if you're having knee pain. She starts asking me about my exercise regimen, what I'm doing. She's okay, you're doing yoga, you're doing this, you're doing that. But are you exercising your quads? Sounds like you're doing all hamstrings. And so, and it was true. I'd been ignoring my quads. So I started getting back into squats and paying attention and focusing on my warriors and things like that, really focusing on the quads. No knee pain anymore. So I think what my experience has been is not too unusual, right, Pegah? A lot of people come to see you and they don't really think there's a chance you'll be able to do something. You tell them something that's very simple and they just have to make a slight change to the things that they're doing and that pain and discomfort goes away.
Oftentimes, it depends. I have different kinds of patients. I have patients who want to do the natural route, and so they see Eastern medicine as that. And so they come see me. I have patients whose doctors send them to me. Oftentimes, it's because they're like, I don't know what to do with you. Go see Pegah and see what she can do. And then I have patients who come initially for maybe something that's orthopedic, and then they see that they get better, and so we work more on other things that they never thought about. So there's different ways that people come my way.
Yeah.
Yep.
Well, let me ask you about, so the Western side. Obviously, Western medicine is a lot of drugs. It's a lot of sort of reactive stuff. It's like, oh, okay, you have a problem. Come here, we'll give you this drug, and that'll.
Here's some antibiotics.
Yeah, that'll fix it, or
Here's some antibiotics for antibiotics.
Yeah. So that's kind of the Western side, right? And that probably didn't appeal to you, just sort of the way that illness and disease is treated.
Not necessarily. I always tell people, God forbid, if you're in an accident, go to the ER. You don't come to me. Come to me after, but go to the emergency room. So there's definitely times where Western medicine is needed and is incredibly important. Eastern medicine has its place as well. You talk about drugs in Western medicine, we have herbs. So I give my patients herbal formulas. And there's so many research out there on the different kinds of herbs and herbal formulas that we use that you just have to go to PubMed and find all the information that you need. Having said that, though, I do have patients who are on medication. And sometimes they want to start coming off of that. And that's not just done willy-nilly. You know, I'm oftentimes in touch with our physicians. We talk about what route we're going to be taking. I do prescribe them herbs if it's applicable, and it's done in a very gradual manner, right? So Western medicine definitely has its place, and Eastern medicine has its.
Okay, but you chose Eastern.
But I chose Eastern,
Now,
yes.
when we say Eastern, we're talking about like natural, holistic, but acupuncture is sort of the basis for this Eastern medicine, right?
I practice Chinese medicine. Chinese medicine has acupuncture, herbology, and as well as bodywork, Tuina.
Tell us about Qi. All right, I don't know if anyone's seen Kung Fu Panda 3. I don't want to ruin it.
Not Kung Fu Panda 3.
Not the third one?
1 and 2, yeah.
Yeah, it's all about Qi. It is. It's pretty interesting. But you talk about Qi and getting energy flowing in your body. And sometimes energy kind of gets stuck somewhere in the body. And that's what causes spasms or tightness sometimes and things like that. And somehow, some way, I have no idea how they figured this out. Because it must have been a really tough couple hundred years as they were figuring out how acupuncture works. But somehow, you stick these needles, these really tiny needles that don't hurt at all, in the body, and it gets this energy flowing again. I mean, how do you explain something like that?
Well, it depends what we're talking about,
Yeah.
right? So when a muscle spasms, the fibers aren't firing properly. And oftentimes, when you put a needle into a muscle fiber, like you keep saying, you reboot that firing sequence. And so
Gotcha.
it stops it from spasming.
And I'm admitting this now, I can't hide from it forever. Last time I saw you, we put needles in my bum, right? Because,
Yes, I did.
because there's no way to like stretch a certain muscle that's deep
Right.
down in there. That's a really crucial place. There's like a muscle, you said there's no matter what, a massage with the elbow, there's no way to get as deep to that muscle as you could get. And I'm telling you, it fixed me right up. I mean, immediately. I walked out of there feeling fine. And I've had a lot of hip pain. I have to do a lot with my glutes to sort of combat that. And that was incredible. So like, what happens in that case? Like when you have one of those situations, what's going on there?
So in that case, it's not just the needle going into the muscle and how deep it's going into the body. Usually when we put a needle in the body has a reaction because it's a foreign object. So this cascade of stuff happens in the body. And by default, what you get from it is a relaxed muscle from what I've done. So it's more intricate than just saying stick a needle in it. Although you can.
That's what it seems like. I mean, every time I have a pain now, I'm like, I need to get Pegah to stick a needle in this thing.
Although you can. But I mean, we treat things very differently. So for example, with your bum, the issue that you had, I did a local point for you. I did a lot of other distal points as well to support what I was doing, but we can treat things using distal points. For example, if I have a patient who comes in with a frozen shoulder, I'll do a point on their lower leg, and that helps the frozen shoulder. They're able to move it. That same point can also be used in treating diarrhea or constipation. So the points that we have multiple functions, and it's how you use those points and how you use them together that gives you the result that you want.
And through acupuncture and this Eastern medicine, you can essentially treat almost everything that's not an emergency. So from, menstrual cycles to, shoulder pain or neck pain or migraines or all that stuff, right?
Right.
Do you have a
About
question?
bones or like muscle tears, tendon tears.
Yeah,
that's more-
all of those. It depends on the degree of the tear. So if it's something that's really, really deep or a big tear, then of course surgery is needed.
Okay.
But I do see patients before and after surgery. And before surgery, just kind of to get them calm and get them ready for the surgery, and then after to heal faster.
Okay.
So yeah, I see them during that time.
And there's a lot of preventative stuff that you can do too, right? Now, explain to me what happens when I'm laying there, there's needles in me, and it's maybe 5 minutes after you've stopped putting needles in me, and all of a sudden, like, body parts start kind of twitching, but then you immediately feel this incredible feeling shortly thereafter. What is going on there?
You're releasing happy hormone. It's the endorphin.
That's it.
It is
Happy
now.
hormones?
It's the endorphins. I mean,
Okay.
that's one thing. We've done so much work on trying to figure out what happens to the body when you do acupuncture. And there's a lot of studies out there that you can read. The brain chemistry changes, a lot of hormones get released, a lot of stuff really happens. And I like to think of it more as you got a good treatment. You
Yeah.
know, what I did was what you needed, and my diagnosis was on point, and you're enjoying.
As it has been every
What
time.
I did.
It has been. Speaking of studies, you did one recently.
I did.
Can you tell us about it?
Yeah.
Tell us about that.
So I did a study on treating osteoarthritic knee pain using auricular acupuncture. Auricular is points that we do in the ear. And I used 5 points in the ear. And I'm very proud to say that it was 98% success rate.
98%?
Yeah, it was a pretty high success rate. We were all kind of a little surprised by that.
So wait a minute, you're treating knee pain with needles in the ear.
Yes.
And it had a
arthritic pain.
98% success rate.
Yep.
That's insane. So
That
when are you going
is-
to be
that
like
is pretty
on,
neat.
you know, national TV telling people about this? That sounds amazing. How does that work? How does the ear help the knee?
How does it work? Well, there's a lot of points in the ear. There's a microcosm, macrocosm effect that takes place. So in Eastern medicine, when you look at the ear, there's a map and there's a human on it. And there's a little part in the ear that's specifically for the knee. There are also other points that I used that were good for pain. So again, we're talking about releasing the happy hormones we talked about, right? And then there's also some points that are good for just general calming and grounding. And what they have done is when they put a needle in the area that's, let's say, for the knee, they have looked at the brain on a functional MRI, and they see that the area for motor as well as sensory to the knee lights up in the brain. So there is a very direct correlation of what happens when a needle is placed in that part of the ear.
Fantastic stuff. Thank you so much for coming in today and sharing your wisdom with us. Really appreciate your time.
Thank you
Pegah
so much for having
Homayoun,
me.
the doctor. My doctor.
The doctor, your doctor.
My doctor. All right, stick around for more Smarter San Diego TV, where we guarantee to make you smarter than everyone else, commercial free.